Your bill is going to enjoy a do pass recommendation.
Good, not afternoon, but good evening, members. I'm pleased to present Assembly Bill 2424, which would create the Health Improvement and Innovation Fund. This fund will ensure that all Californians are able to achieve optimal and equitable health. I greatly appreciate the support of my colleagues. I'm going to hand it over to my supporters. Thank you so much.
Thank you, Mr. Chair and members. Kat Duberg with the Health Officers Association of California in strong support of this bill, which has strong state oversight and also allows for local innovation to improve the health of all Californians against our most important chronic diseases. Thank you.
Chairman, other members of the Assembly, Health, I'm Dr. Mark Horton, a pediatrician and previous state health officer and director of the California Department of Public Health. Speaking on behalf of the Health Officers Association of California in support of the bill. Chronic disease accounts for 8 of every 10 deaths in California. 42% of all of our public health care expenditures are $98 billion a year, plus indirect costs of another $51 billion. It affects 14 million Californians, including many of us in this room, and certainly we all have families and friends with chronic disease. Obesity and diabetes, in particular, have grown rapidly. Today, 2.5 million adults in California, 9% of the adult population, has diabetes. Another 13 million adults, or 46% of the adult population, are estimated to have prediabetes or undiagnosed diabetes. 15% of those 13 million, or nearly 2 million adults, will develop full-blown diabetes over the next 5 years. We are not talking about a steady state here. You know, so many new diagnoses, so many deaths, about the same number of people with diabetes. We're talking about a tsunami. We're talking about a tidal wave of newly diagnosed diabetics in this state, causing individual disease and suffering, huge stress to our healthcare system, and enormous costs. Much can be done to identify prediabetes and to manage diabetes in the clinical setting. What is urgently needed are resources at the community level to address the environmental and behavioral risk factors that lead to overweight and obesity, which in turn predispose to developing prediabetes and diabetes. Much the same can be said of other chronic conditions such as hypertension, stroke, heart disease, and cancer. As many as 8 of every 10 cases of heart disease, stroke, and type 2 diabetes, and many cancers can be prevented by preventing and eliminating the risk factors. This $380 million proposal would support community-based chronic disease and injury prevention efforts that would address the well-recognized underlying behavioral and environmental determinants of illness. The largest block of funds would go to local health departments that would work with community partners to address these risk factors. Funds would reach all counties, prioritize disadvantaged communities, and allow continuous, reliable prevention operations. The remainder would be delivered through competitive allocations to community-based organizations and nonprofits. Each community would use its funds directly according to its needs under rigorous state oversight. The fund would support evidence-based prevention interventions, but would also encourage innovation. To prevent chronic disease that drain our healthcare dollars requires sustained, reliable, and flexible investments in our communities. Please support the bill.
Thank you. Others in support, name and organization only, please.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Thank you.
Tam Ma with Health Access California in support.
Thank you.
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Thank you.
Michelle Gibbons with the County Health Executives Association. We support the measure and concept.
Thank you.
Matthew Marson with Public Health Institute in support.
Thank you. Anyone in opposition? Seeing no one, questions, comments from the dais? Mr. Gomez, would you like to close?
Mr. Chair, thank you. I thank my supporters and ask for your aye vote.
Okay. Do we have a motion and a second? Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke?
Sorry,
Burke,
the motion was
Campos?
due pass as amended to approach. My apologies.
Oh, there's no amendment.
There's no amendment. Never mind. It's a wrong sticky note. Do pass.
I didn't get Stewart Thibodeau. Campos. Campos, aye. Chu. DeBobney. Gomez. Gomez, aye. Hernandez. Hernandez, aye. Lackey. Lackey, aye. Nazarian. Nazarian, aye. Olson. Patterson. Patterson, no. Ridley Thomas. Rodriguez. Rodriguez, aye. Santiago. Santiago, aye. Steinnorth. Steinnorth not voting. Thurman. Waldron. Waldron, aye. Bonilla, aye. Chu, aye. 14-1.
14-1, your motion, your item is, your bill is out. Mr. Chairman, last bill, everybody.
13-1.
Actually, I don't think it is. I think Mr. Chu has a bill, but he stepped out, so that's why I jumped up here.
Oh, okay. Well, we're hopeful.
So I don't know where Mr. Chu went, but
go ahead, Mr. Chairman.
Come back, Mr. Chu. Assembly Bill 2024 is before you. Assembly Bill 2024 permits federally certified critical access hospitals to employ physicians and charge for their professional services and increase access in rural communities.
We have a motion and a second. Witnesses in support. Oh, I'm sorry.
Respectfully ask for your aye vote.
Witnesses in support.
Barbara Glazer with the California Hospital Association, representing approximately 400 hospitals here today in support. We really believe this bill will give critical access hospitals the tools they need to improve access to healthcare in communities, to recruit and retain more physicians who are very interested in employment, and it will go a long way towards helping them.
Thank you.
Kelly Brooks on behalf of the Association of California Healthcare Districts. We're also here today in strong support. 20 of the critical access hospitals in California are district hospitals. In addition, 54 of the 78 healthcare districts in California operate in rural and underserved areas. We agree this will help attract and retain physicians, particularly in rural areas. We have an aging workforce. A lot of the physicians are over 60, and we anticipate retirement affecting our ability to continue to provide quality services to rural Californians. Thank you.
Thank you. Further witnesses in support, name and organization only, please.
Catherine Austin Scott, representing the District Hospital Leadership Forum, in support.
Tam Ma with Health Access in support.
Lisette Short with Loma Linda University Health, Adventist Health, and the Alliance of Catholic Healthcare in support.
Mandy Lee on behalf of Sutter Lakeside Hospital, Critical Access Hospital, in support.
Stuart Thompson on behalf of the California Medical Association. We have some outstanding concerns with the bill. We're not listing the analysis, but we thank the author for continuing to work with us to resolve those issues. Thank you.
Thank you. Any other witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Questions or comments from the committee? Seeing none. Mr. Wood, you may close.
Respectfully ask for your aye vote.
We have a motion and a second. I'd ask, the motion is due pass to approps. I'd ask the clerk to please call the roll.
Wood.
Aye.
Wood, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Chu, aye. DeBobney? Gomez? Gomez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Nazarian, aye. Olson? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. Thurman? Waldron? Waldron, aye.
Your bill is out.
Thank you very much. Mr. Chu?
Yes.
Okay, so.
Okay. Please, members need to come to the room to vote. Appreciate it. Let's start from the.
So these need a motion.
Okay.
These need to have the call lifted.
Okay.
To add on, and then we can go in there.
Okay. Item number 1, AB 1763. We need a motion on that bill. Let me motion and a second. We'll have a roll call vote, please. The bill is the motion is due pass as amended to appropriations.
Wood.
Aye.
Wood, aye. Mainshine.
Aye.
Mainshine, aye. Bonilla. Bonilla, aye. Burke. Burke, aye. Campos. Campos, aye. Chu. Chu, aye. DeBobney. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Lackey?
I'm sorry.
Lackey, aye. Nazarian? Nazarian, aye. Olson? Patterson? Patterson not voting. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. Thurman? Waldron? Waldron not voting. $13-0.
So that bill is out on a vote of 13-0. Olson, aye. That's 14-0.
Olson, aye. Yeah, number 2 actually needs 4 votes. I'm sorry.
So we'll go ahead and remove the call, open the roll, have Madam Secretary call on AB 1764, item number 2. Waldron.
Mainshine?
Aye.
Mainshine, aye. Bonilla? Bonilla, aye. Burke?
Yes, aye.
Burke, aye. Campos? Campos, aye. Chu? Chu, aye. DeBobne? Gomez?
Mr. Gomez? Not voting.
Gomez not voting. Ridley Thomas? Rodriguez? Rodriguez not voting. Santiago? Aye. Santiago, aye. Steinnorth? Steinnorth, aye. Thurman? 13-1.
So that item is out 15-1.
13-1.
13-1, excuse me. My apologies. Item number 3, AB 1831. We'll lift the call the absent members.
Mainshine?
Aye.
Mainshine, aye. Campos?
1831.
Campos, aye. Chu? Chu, aye. DeBobne? Gomez? Gomez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Patterson? I'm sorry, Patterson's not voting. You want to move to... Patterson, aye. Ridley Thomas? Santiago? Santiago, aye. 17-0.
So that is 17-0. That bill is out. Item number 4, AB 1931, Rodriguez, lifting the call the absent.
There's no call.
Oh, there is no call. Sorry. We'll be adding votes at this point on this one. AB 1931, item number 4. Sorry, I didn't mean to. Low blood sugar. No blood sugar.
Bonilla? Bonilla, aye. Burke? Burke, aye. Chu? Chu, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Olson? Olson, aye. Thurman? That's 18-0.
18-0, that bill is out. Item number 5, AB 1954, lifting the call the absent members.
Chu? Chu, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Olson? Olson not voting. Patterson? Patterson, no. Ridley Thomas? Santiago? Santiago, aye. $13-4.
That is 13-4. The bill is out. Moving on to item number 6, AB 2004, Bloom. We need a motion on this bill. We have a motion and a second. Madam Secretary, please call the roll. The motion is due pass as amended to appropriations.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Chu, aye. DeBobne? DeBobne, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Nazarian, aye. Olson? Olson, aye. Patterson? Patterson not voting. Ridley Thomas? Rodriguez? Rodriguez, I. Santiago. Santiago, I. Steinnorth. Steinnorth, I. Thurman. Waldron. Waldron, I. 16-0.
That vote is 16-0. That measure is out. Item number 7, AB 2024, just as lifting the call, adding additional votes.
DeBobney. DeBobney, I. Olson.
Yes.
Olson, I. Ridley Thomas. Thurman. 17-0.
So that. Yes, we have you down. Yes, thank you. So that is 17-0. AB 2050, Mr. Steinnorth, this is adding additional votes.
Wood. Wood.
Oh, that's right. I'm sorry. Yes, aye.
Wood, I. Bonilla. Bonilla, I. Burke. Burke, I. Chu. Chu, I. Gomez.
Aye.
Gomez, I. Hernandez. Hernandez, I. Nazarian. Nazarian, I. Olson. Olson, I. Thurman. 18-0.
Okay, item number 9, AB 2104, adding additional votes.
Bonilla. Bonilla, I. Burke. Burke, I. Chu. Chu, I. Gomez. Gomez, I. Hernandez. Hernandez, I. Olson. Olson, I. Thurman. 18-0.
18-0, that passes out. Item number 10, AB 2134, Waldron, lift the call and call the absent members.
Mainshine? Mainshine not voting. Bonilla? Bonilla, no. Burke? Burke, no. Campos? Campos, no. Chu? Chu, no. DeBobney? DeBobney, I. Gomez?
No.
Gomez, no. Hernandez? Hernandez, no. Nazarian? Not voting. Ridley Thomas? Thurman? 6-9.
That measure is 6-9. The measure fails. Okay. Granted.
DeBobney not voting. So that's 5-9.
So the vote is 5-9.
I'm sorry.
I'm sorry, wait a second.
Yes, 5-9.
5-9. Item number 11, AB 2174, just adding votes. Mr. Jones. So, correct?
Yes. Bonilla? Bonilla, no. Burke?
2174, item 11.
Burke, I. Chu? Chu, I. Nazarian? Nazarian, I. Olson? Olson, I. Ridley Thomas? Santiago? Santiago, I. Thurman?
They got you.
Lackey, I.
Got you.
Patterson, I have you.
You're right.
You're right. You're right.
Hernandez, you're right.
You're right.
16-1.
So that vote is 16-1, and that one's out. Item number 13, AB 2209, Bonilla. Lift the call and call the absent members, please.
Mainshine?
2209, item 13, Bonilla.
Aye.
Mainshine, I. Chu? Chu not voting. DeBobney? DeBobney not voting. Gomez? Gomez, I. Hernandez? Hernandez, I. Lackey? Lackey, no. Nazarian? Nazarian, I. Olson? Olson not voting. Ridley Thomas? Rodriguez? Rodriguez not voting. Santiago?
Correct.
Santiago, I. Steinnorth? Steinnorth, no. Waldron?
That item is a vote of 10-3. It passes out. Item number 14, AB 2213. This is for additional votes.
Chu? Chu, I. DeBobney? DeBobne, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Patterson? Patterson, aye. Santiago? Santiago, aye.
I didn't vote on that.
You did.
I know. I have the same feeling, Mr. Nazarian. I know exactly how you feel.
19-0.
19-0. We actually have one that was 19-0. Yes, you did. Yes, you did. Thank you very much. Item number 15, AB 2255 Melendez. We need a motion. We have a motion and a second. Madam, this is due pass as amended to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Chu, aye. DeBobne? DeBobne, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Nazarian, aye. Olson? Olson, aye. Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. Thurman? Waldron? 16-0.
That item is at 16-0. Moving on to item number 17, and it passes. Excuse me. I'm sorry. Item number 17, AB 2372 Burke. This is to add on.
Chu? Chu, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Patterson? Patterson not voting. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye.
That one is 18-0. Moving on. Item number 18, AB 2403 Bloom. This is to adding votes. No, I'm sorry. Wait a second. Oh, wait a second. We need a motion on that one. So we have a motion and a second. Madam Secretary, the motion is to due pass is amended to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke not voting. Campos? Campos, aye. Chu? Chu, aye. DeBobne? DeBobne, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Nazarian, aye. Olson? Olson not voting. Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. Thurman? Waldron?
So that measure passes 14-0. Item number 19, AB 2424 Gomez. Adding votes.
Olson? No. Oh, I'm sorry. DeBobne? DeBobne, aye. Olson, no. Ridley Thomas? Thurman? 14-2.
So that passes 14-2. Item number 20, AB 2436, Mr. Roger Hernandez, adding on votes.
Chu? Chu not voting. DeBobne? DeBobne, aye. Olson? Olson, no. Steinnorth? Steinnorth, no. Thurman? Waldron?
So that is 11-5 and moves to appropriations. AB 2439, item number 21 Nazarian. Lift the call and call the absent members, please.
Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Chu, aye. DeBobne? DeBobne, aye. Gomez? Gomez, aye. Lackey not voting. Olson? Olson, no. Thurman? 14-1.
That measure passes 14-1. Item number 22, AB 2467 Gomez. Please lift the call and call the absent members.
Mainshine? No. Mainshine, no. Bonilla?
Aye.
Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Chu, aye. Lackey? Lackey, no. Ridley Thomas? Santiago? Santiago, aye. Steinorth? Yes. Steinorth, no. Thurman?
That measure passes 11-6. Let's see. Item 23, AB 2507, lifting the call. Please call the absent members.
Mainshine?
2507, Gordon. Sorry,
Mainshine not voting. Bonilla? Bonilla, aye. Burke? Burke, aye. Chu? Chu, aye. DeBobne? DeBobne, aye. Hernandez? Hernandez, aye. Lackey? Lackey not voting. Nazarian?
Aye.
Nazarian, aye. Patterson? Patterson, no. Ridley Thomas? Santiago? Santiago, aye. Steinorth? Steinorth not voting. Thurman? Waldron?
So that measure passes 11-1. Item number 25, AB 2640, Mr. Gibson. I'm looking for a motion. We have a motion and a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mainshine?
No.
Mainshine, no. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Chu, aye. DeBobne? DeBobne, aye. Gomez? Gomez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, no. Nazarian? Nazarian, aye. Olson? Olson, no. Patterson? Patterson, no. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinorth? Steinorth, no. Thurman? Waldron?
The measure passes 11-5. Item number 28, AB 2752, Nazarian. Lifting the call. Please call the absent members.
Mainshine? No. Mainshine, no. Bonilla? Bonilla, aye. Chu? Chu, aye. Olson? Olson, aye. Thurman? 14-3.
That measure is 14-3 and passes. Item number 29, AB 2764, Bonilla. Lifting the call. Please call the absent members.
Mainshine?
Not voting.
Mainshine not voting. Chu? Aye. Chu, aye. Hernandez? Aye. Hernandez, aye. Nazarian? Aye. Nazarian, aye. Olson? No. Olson, no. Patterson? No. Patterson, no. Ridley Thomas? Rodriguez?
Aye.
Rodriguez, aye. Santiago?
Yes, sir.
Santiago, aye. Steinorth? Steinorth, no. Thurman? Waldron?
What?
11-3.
That measure passes 11-3. Item number 30, AB 2775, Gallagher. Madam Secretary, lift the call and call the absent members.
Mainshine? Mainshine, aye. DeBobne? DeBobne, aye. Hernandez? DeBobne, no. Hernandez? Hernandez not voting. Nazarian?
No.
Nazarian, no. Ridley Thomas? Santiago?
No.
Santiago, no. Steinorth?
Yes.
Steinorth, aye. Thurman? Hernandez, no. Six to 10.
That measure fails 6-10. On item number 31, we will grant reconsideration if it's requested. Item number 31, AB 2821, Mr. Chu, this is just to adding on.
Alston? Alston, no. Patterson? Patterson, no. Ridley Thomas? Santiago? Santiago, I. Steinnorth? Steinnorth, I. Thurman? 14-2.
So that final vote is 14-2. Final item, number 32, AB 2832, Travis Allen. Lifting the call, please call the absent members.
Bonilla? Bonilla, no. Chu? Chu, no. Olson? Olson, not voting. Ridley Thomas? Santiago? Santiago, no. Thurman? Waldron?
So that item fails 6-9. We'll go through the consent calendar add-on and then give an opportunity for you to change your vote on. So the consent calendar is AB 2325, 2589, 2750, 2670, 2207, 2889. These are votes to add on.
Do we have a motion on the consent?
Oh, yeah, we did. Oh, yeah. 11 votes on it or something. It's in there somewhere. We're going through. Hey, she's trying to find the roll.
Sure. I thought I okay.
Got it?
We didn't vote on consent.
We did not vote on the consent calendar?
No, we did.
We did. Yeah. We have 11.
Let me have her.
No. This is a different vote. This is a different vote.
Okay. Hang on.
Okay, just repeat it. This is the consent vote right now. So would you need to make a change on this one?
Okay.
Okay, are you sure you don't have it?
That's 12 is the first consent, right?
Right. So okay, so just this is it. Wood voted aye. Mainshine voted aye. Campos voted aye. Dababne.
Did you vote? Chu did not vote for the consent.
Hernandez. Why don't you just recall it?
We're going to recall. We're just going to recall through. Well, we're going to lose.
Sorry. So Hernandez, Lackey, Patterson, Rodriguez, Steinworth, and Waldron. That's what I got.
Okay.
So
all right. Bonilla? Bonilla, aye. Burke?
Yeah.
Chu? Chu, aye. Olson? On
Consent calendar, sorry.
Olson, aye. Patterson?
He was an aye.
I'm sorry, Patterson, aye. Ridley Thomas? Santiago? Consent. Santiago, aye. Thurman?
Well, yeah. So we can.
Okay. Okay. So that does conclude. So you had a vote you wanted to change.
Burke, AB 1954, not voting aye.
And the consent 17-0.
So the consent is 17-0. AB 1954, Burke, item number 5. She's changing to aye. So we're going to leave the roll open for 30 seconds. Okay. And this was not a record, by the way. Apparently, hearings in the old days went to midnight sometimes, 2 or 3 in the morning. So, just saying. Oh, Miss Waldron. please come on up here and we'll let you add on. So, and I'm not sure what the rest of you guys are hanging out here for, but.
I have it right here. It's okay.
And we've got about an hour of fuel left. Don't worry. And then start circling around Sacramento.
32.
50 minutes later. Parachute out here, but I don't have a parachute.
Okay.
What was bad? They told us how much time, and then 15 minutes later, we're like, we're gonna die. We got 10 minutes, man.
That stuff gets it in 7.
No, that was creepy. And then the guys announcing, well, we still have some time. We're like, what? 10 minutes? Now we're gonna do the emergency landing on it, man. I couldn't look at my face, so I can't make fun of my face. But to look at his face and Erwin's face, and everybody on the floor was like, believe it. Stop voices on.
No, it's okay. It's
Texting your goodbyes to everybody.
I don't know what I'm gonna do. Mike, I'm gonna go eat a piece of bread and get a beer and go to bed. Meeting adjourned.